We all know COVID-19 has become a national pandemic and is spreading rapidly throughout the world. But what if I told you that according to journalist Mark Wilson, who studied the site covidspreadingrates.org, by the time I count to 10, 22 people across the globe will have caught COVID-19. COVID-19 is a real problem and we all need to use what we know to help stop the spread. I have several family members who are considered high risk for developing severe and potentially deadly symptoms from COVID-19, so learning how to protect them, myself, and others has become a priority for me. Today, I will tell you who is at high risk for catching COVID-19 and developing severe and potentially deadly symptoms. I will discuss how the virus spreads, and I will tell you what you can do to help stop the spread. First, let's discuss who is at high risk for catching and developing severe symptoms from COVID-19. According to the staff at Mayo Clinic, anyone can catch COVID-19, but it mostly affects middle-aged and older adults. Anyone age 85 or older is considered extreme risk for developing severe symptoms, and 80% of the deaths in the United States from COVID-19 have been people aged 65 or older. If you have any type of lung problem, it can increase your chances of getting severe symptoms since COVID-19 attacks the lungs. The staff at Mayo Clinic says COPD, asthma, cystic fibrosis, and even smoking increase your chances of serious symptoms, and medications that are given to treat these conditions often weaken your immune system, which puts you at even higher risk. Anyone with diabetes, heart disease, high blood pressure, obesity, cancer, sickle cell, HIV, or a weakened immune system is at extremely high risk for developing severe symptoms from COVID-19, according to the staff at Mayo Clinic. I'm sure we all know at least one person with at least one of these risk factors. So let's talk about how COVID-19 spreads. According to the CDC, COVID-19 spreads easily between people, and people can have it without even knowing it and give it to others. There are two main ways the virus spreads according to the CDC. These are through direct contact or exposure to respiratory droplets from an infected person, like when they cough or sneeze, and through airborne transmission. Airborne transmission happens when you are further than 6 feet from the infected person, but you are in an enclosed area with inadequate ventilation, and the infected person is often doing something that requires heavy breathing, such as exercising or singing. Now we know who is at risk for severe symptoms and how COVID-19 spreads. Let me tell you how you can protect yourself and others. According to the FDA, there are 3 simple steps we can all take to help stop the spread of COVID-19. The first one is to wash your hands frequently. The FDA recommends washing your hands with soap and water for at least 20 seconds, especially after using the bathroom, coughing, sneezing, or blowing your nose. The second step we can take to help stop the spread is social distancing. The FDA recommends that we stay at home as much as possible, but if we do have to go out, avoid close contact and try to remain at least 2 arms lengths or 6 feet between you and others. The third and final step we can take to help stop the spread of COVID-19 is to wear a mask. I know they're uncomfortable and often unfashionable, but they are very important to help stop the spread. The FDA states that they can help people who may have the virus and do not know it from transmitting it to others. A cloth mask can act as a simple barrier and help prevent respiratory droplets from traveling through the air when a person talks, coughs, or sneezes. In conclusion, I have told you who is at high risk for developing severe symptoms from COVID-19. I have told you how COVID-19 spreads, and I have told you what you can do to help stop the spread of COVID-19. So please do your part and protect yourself and those who are close to you.